Hello, my friend. Zhao Martins, licensed marriage and family therapist, couples therapist. Today, I want to talk a little bit about substance abuse and ADHD. I got a question from one of our viewers about that. I'm not an expert on substance abuse. It was never my specialty. But I'm familiar with how ADHD and substance use disorder, SUD or SUD, can be related. So I will put Russel Barkley's website, YouTube channel, and some videos down there. He particularly talked about the relationship between the two, ADHD and SUD. So let me just give you a 1-minute summary of his video. He talked about how ADHD diagnosis can increase the chance of a SUD, substance use disorder, because ADHD is such a reward-seeking, sensation-seeking based, and it is a regulation disorder where I call it challenges, because the prefrontal cortex is delayed in development in people diagnosed with ADHD, so that tend to lead to some regulation challenges, mood, impulses, right? And also tend to make decisions on a short-term rewards based on long-term benefits. That can show up as making some poor choices. And not just the substance we are thinking about regularly, like alcohol, coffee, caffeine, marijuana, but also could be some other substance that we call harder drugs, right? For the stimulation and also for the avoidance. So how I see it is that people use substance for two reasons. One is to avoid pain, perceived pain. Like anxiety, sadness, anger, feelings they don't want to feel, or sensation that's too strange and uncomfortable for them, or to seek pleasure, which is actually the same thing. Pleasure in some way is the opposite of pain. It's comfort, right? It could be a sense of relaxation. Think about using marijuana and CBD, right? To induce a sense of relaxation. Alcohol also have similar effect. Or pleasure as for stimulants that give you this high feeling in the brain. So basically, it's the two things are the same, two sides of the same coin. Avoid pain, seek pleasure, same thing. Right? I call it pleasure. So if you have that experience, you know what I'm talking about. Sometimes too much pain can be pleasurable, and sometimes too much pleasure can be so painful as well. One example, in sex. If you have ever had orgasm that is so intense, you feel like you're dying, you're taken away, that you're losing yourself, that you're afraid that you're being annihilated or you're gonna explode because of the orgasm, you're actually in sort of pain. You have so much pleasure that you're in pain. Or sometimes when you're in pain, say if you have some cramps, that if you don't take a pain medication to avoid it, to dull your senses, if you observe your pain, go to the center of your pain and relax into that, you notice how you sweat a little bit and your body come in and out of a sensation of pain. It's actually quite pleasurable. Like you're really in your body, you feel your body fully. I tend to do better therapy when I'm having a little bit of pain, to be honest with you. I'm very present in my body when I have that. It's hard to go to my head when I'm so in my body. So not only ADHD can make people more vulnerable to have substance use disorders, other situations can also cause SUDs. For example, PTSD, complex trauma. It's the same thing. It's a regulation challenges that we can't regulate our nervous system in a way when we're faced with certain stressors in life. So if you're not familiar with PTSD, I encourage you to go to the link I put in my video down below in the comment section. It's called ACE assessment, adverse childhood experiences. So you go through a very simple test, see how many things you crossed and rate yourself. Then you can have a sense if you might have a complex trauma, which basically saying you grow up or you go through life in a period of time where you're exposed to certain stressors repetitively that it altered your nervous system. You have this neural pathway that you always go that way and get you stuck, and then you feel overstimulated and you can't handle the stimulation, which is feeling like painful. And people tend to dissociate, go away, avoid from the sensations or feelings that make them feel uncontainable by doing certain substance to help them avoid the pain or increase pleasure. Again, it's the same thing. So what are some of the sensations in your body that you have a hard time tolerating? It depends on your nervous system. It depends on how you're wired and how your childhood experience like with your attachment figure. Some people, palpitation is often unfamiliar, uncomfortable sensation for people. You feel your heart is beating so fast it's about to come out of your chest, and people turn it as a panic attack, right? So another one could be this heaviness in the heart that we now identify as sadness, like this pulling down sensation. Like people are not comfortable with that, and then they don't go to grief. And in order to stay away from grief, what they do, they seek sensations that's pleasurable for them. It could be drinking something, it could be sex, it could be watch porn, it could be online social media, whatever that give them that pleasure for that moment, so they can stay away from the deep down sad heaviness that maybe they need to face and grieve the losses and to move on, but they're so afraid to go there. They're afraid they're going to be taken over by those sensations, that they will never get up from the depression anymore. So that comes, from your perception, right? If you have done that work before, you go through grief and you come out of it and you go in waves, but it does not destroy you. So another sensation people that don't like could be tension in the body. It could be tension in the chest, tension in the stomach, like this knot in the stomach, right? That tend also to be your body is protecting you from feeling some feelings that you're not comfortable with. So you are staying away from that sensations that you have a perception, I can't contain that. I'm not going to be okay if I go to the center of that sensation. Again, based on my experience of exploration, nothing will destroy us. We move through that, we will be just fine, and we'll be better after, actually. But I can see how scary it is to go in there and discover something, right? So those are the sensations people may have a problem with. Oh, and also some people who have fear of intimacy. I forgot about that. When you feel intimacy and connection in the heart, you tend to feel this swollen, expansive sensation in the chest, where there's just so much room in there and you feel so vulnerable, like your heart could be pierced by something. That's love, intimacy, and connection. And some people have a hard time tolerating that, maybe because they had an experience before and then got their heart broken. So they were like, if I have my heart open and feeling all those emotions, swelling sensation, I'm afraid it's gonna burst and I'm gonna die or disappear, or it's gonna get pierced and I will die. So basically it'll come back to death, right? So death and being annihilated, being killed, being destroyed, explode and disappear. All come to that, you disappear. Guess what? We all gonna disappear at some point. And I'm talking about our body, right? Disintegrate at some point. But our soul doesn't go away, according to my belief. So you're just gonna come back in a different form. And you've done it so many times, according to my belief. Again, you don't have to believe in that. But what I'm saying is the fear, the ultimate fear for people is that death, being killed and annihilated, right? Which is the destiny. So why fear about that? Let me bring you back a little bit to our ADHD affected relationship. Again, based on the model, well, people get diagnosed with ADHD, there's association between ADHD and SUD, higher chance of having SUD. From my view, that is not, I'm not in a medical model where I diagnose people and think everybody's labeled in that way. You can get diagnosis and medication treatment and help you if that's aligned with your value, that help you, right? For me, there's the more ADHD partner on this spectrum, that you have more symptoms and then that make your life difficult, your relationship difficult. And there's the less ADHD partner. You can saw non-ADHD partner, which is actually quite binary, or I call it less ADHD partner, like compared to this partner. Some of my clients, both of them have ADHD, but they still play out this ADHD affected relationship dynamic, which is interesting. There's the more ADHD partner, there's the less ADHD partner, right? It's relative. So if the more ADHD partner that activate the less ADHD partner, and the less ADHD partner take on the drama role as the rescuer. I am higher than you are. I am gonna save you, poor you, you're incompetent in this area, let me help you so you'll be better. Or this part, or the less ADHD partner saying, well, I'm the victim here, that you did this to me, accusing the ADHD partner, more ADHD partner, for doing things that hurt them. They're taking on the victim role and then cast out the villain projection onto their partner with more ADHD symptoms. That's also a very common dynamic I see. So it doesn't matter which dynamic you're in, that you can fall in to both at different times. You're not really in an equal place as for a pure relationship. And you actually suffer from not seeing something. That's the truth, which is both of you are suffering and both of you are having pain. That instead of trying to fix the other person, look at what's the problem between the two of you. How do you work together as a team to resolve the issue? So the relationship dynamic between the more ADHD and less ADHD partner in this parent-child dynamic, or victim and villain dynamic, or rescuer and rescuee dynamic, victim dynamic, it's the same dynamic to people in codependent relationship when there's one partner abuses substance. The typical thing I think about is, substance abuse, like alcohol abuse and some hard drugs abuse. One partner is the identified patient, that the one that uses and abuses, and the other one is the one trying to save them and also identify the victim by their use of substance. So in some ways, it's a very similar dynamic. So that's also some similarity between ADHD and SUD. So the intervention in some way are very similar. How do you break this dynamic, right? How do you break it? What do you think? Are you willing to look at this? Well, I challenge you that how much of you are taking pleasure, the less ADHD partner, in staying this victim or rescuer position? That don't you enjoy, don't you get high on being the more competent one, the kind one, the compassionate one, the effective one, the efficient one, the righteous one? How fun it is to be in that position, right? Well, if you lose that power over your partner with more ADHD symptoms, who you're gonna be? Who you are going to be? Yeah. You will be facing, honestly, your own pain inside. Your own fear of being rejected, your own fear of being abandoned, your own fear that you don't get the love that you want. You actually have to face intimacy now. That is so scary. If you're not familiar with that sensation I'm talking about in the heart, the swelling, the love, and being supported and loved unconditionally or conditionally, that you may be so afraid to go there that you'd rather stay in this dynamic so you can accuse your partner with more ADHD symptoms from being the perpetrator or put them down as the child in the relationship so you stay up here. How's that for you? As I'm talking, I wonder what you notice inside of you. Do you notice some pulsation in your body in certain area? Or sweaty palms and heat showing up, sweat? Or are you feeling more cold extremity, frozen, and tensioned? I assume you feel more the former one. When you get more activated, generally your body will create more heat. You feel vibration, trembling. You may get even angry at me for speaking the truth, by the way. If you're not ready to hear that, or you may feel energized. I don't know. So that's something to sit with. Until next week, my friend.